Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat. I am so pleased to have the very eminent exotics vet, Madonna Livingstone, with me at the moment. Madonna is in her surgery, so if you're watching this on a podcast, you can see all the many thank you cards you've got. So when people come in and say, it's only a rabbit, they don't go to your practice, do they?
No. It's- the human animal bond is not species specific, so
Exactly.
we don't have it's only at anything here.
Yeah. And of course, your practice is a small animal practice, but you have a lot of exotic work, but you do also see dogs and cats at the practice, don't you?
Yeah, so personally I'm 80% exotics, but still 20% dog and cat work because I love dogs and cats. So I would never want to give up my dog and cat work.
Yeah.
But we have 10 vets. Three of us are primarily exotics, but all of the vets see a small quantity of exotics.
For those who don't know Madonna, she has done many webinars for us. She is an external speaker for Glasgow University, and I think you don't you sort of sweep the board from the awards from the students every year? Is that true? That's what I've
Well,
heard. It's a rumor.
it's a rumor. Oh, I always love rumors about myself. I'm like, oh, what did I do next? I've been lucky enough that I've won the External Lecturer of the Year award from my students for the last 3 years in a row
That is
for
very
Glasgow
impressive.
Vet
Are
School.
you just being banned from next year's awards, or
Yeah, I think so.
have you done it 2 years? You should get the trophy to keep, shouldn't you?
I should. I should. I've heard the other. You know, the word on the street is that the other lecturers have put a hit out on me, but we'll have to wait and see.
So, Madonna, just tell us a little bit about you, just for the benefit of those who don't know you. Obviously, you're very well known to us at Webinar Vet. You've done many really great webinars for us. Obviously, anybody listening from Glasgow University over who've been qualified for the last 5 or 10 years will know you very well as well. But we do get people listening in from all over. So yeah, a little potted history.
Little potted history. Well, my name is Madonna Livingstone. I am a Glasgow graduate. I qualified in 2002. And having always been a firm believer that the human animal bond isn't species specific, I went into exotics work. So currently, I work at the Art Veterinary Clinics Limited in Coatbridge, and my primary role is as a clinician. So I'm a clinical vet. I'm the clinical lead for the selective exotics rotation for Glasgow Vet School. I deliver all the Glasgow Vet School's clinical exotics lectures. I am the external exotics consultant for 2 groups of external laboratories. I write for peer-reviewed journals, and I had my first textbook published earlier on this year. So it's safe to say I'm a bit of a workaholic, but that's because I'm lucky enough my job's my hobby.
This and I was the same when I was in practice. I think if you love what you do, it makes it very easy to sort of do the hours because it does become a bit of a passion project, doesn't it?
Yes, definitely. And I love empowering and enthusing the next generation of vets, but also I absolutely love empowering and enthusing veterinary professionals because I speak at conferences and I've been lucky enough, thank you, for having me back multiple times to speak for the webinar vet, but just allowing vets to realise that exotics aren't as scary as people think they are, and actually they can utilise their transferable skills.
I was very proud of myself, Madonna, very early on in my career. In fact, it was the first job I did a little locum for a friend to help him have a bit of time off. So I was newly qualified, and this guinea pig came in, a very rotund guinea pig, and I thought, oh my goodness, what do I do here? And I took a deep breath and said, no, back to first principles,
Good.
have a listen to the heart and, give a full examination. And of course, have a little feel. And I realized that this was a guinea pig suffering from heart failure. So it had ascites, and I think I gave it some Lasix and maybe a spot. I can't remember now because it's a long time ago. But I just thought at the time, don't be afraid. This is a mammal, and it will
Yes.
work in a similar way to a dog and a cat. Obviously, cats are not small dogs, and rabbits are not small cats, and all those things are all
Yeah.
individual species. But actually, most of them have hearts and legs and things
Yes.
like that. So, if you take it on a logical level, then you can often make real good progress, can't you?
Oh, you're speaking my language. So that's what I tell people. I'm like, don't hit your panic button.
Yeah,
That they are just walking body systems in a different wrapper. You know, a
yeah.
heart is a heart is a heart is a heart. You know, doesn't really matter what species it's in. The function is the same. And I think, yes, there are species specific adaptations and species specific anatomical things that we need to be aware of. But actually, if we do exactly what you did and approach these cases from an area of sameness initially, because all a clinical exam is an assessment of body systems.
Yeah.
But vets tend to hit their panic button and go, oh my God, what do I know about this species? And they don't do what you did, which is take the deep breath and start with what I do know and do my clinical exam first of all and go back to basic principles.
Part of the reason, obviously, Madonna, we've got you on the podcast is to do a bit of shameless promotion for your eminent author. You stole my thunder there. I was going to mention that.
Oh,
But,
sorry.
no, no, it's quite all right. You wrote the book. You deserve it. I did not. Um, Exotics Made Easy, which is, I think, what we're talking about just in that previous conversation. Demystifying rabbits and small mammals. As you say, they're just body systems walking around with a different. I like that. Body systems walking around with a different wrapper on.
Yeah, yep, and that's exactly the way that I think about things.
Yeah.
And 5N Publishing came to me a few years ago and asked me initially to write a book on rabbits. And after I said to them, "Are you sure you've got the right person?" and they laughed and said, "Yes, Madonna, we're sure you've got the right person." And then I realised that I am the only vet in the UK called Madonna, so I get away with nothing. I said to them, well, there are a lot of really good rabbit only textbooks on the market. This is what I would like to do if you were interested, if you want me to write for you, is write the textbook that I wished had been available when I was a new graduate, because
Yeah.
that still wasn't available. So they asked what that would look like. And I told them that I wanted to, empower people to think of it from the first principles and the body systems approach, because then it's less intimidating. But for each species, go through an ethological and science based background as to sort of evidence based for how to keep these animals. What's the husbandry? How do I pull blood off them? How do I, interpret them, but in a non-scary way?
Hmm.
Because most vets, certainly most of the vets that I've spoken to over the years, when they're faced with something they're maybe less confident in, they're not so much needing or wanting to know all the pathophysiology, because the geeks of us, and I am a self-confessed geek, I want to know the pathophysiology, but I can pick a book up and learn that to myself. Most vets want to know, what is it, how do I diagnose it, how do I treat it, what's the prognosis. So that's what I did, because they got 5M Publishing got really excited about that, and here we are.
And it's actually really important that we have, fantastic academics who, spend all their life in research and teaching and all those things. But actually, and this is meant as a compliment, Madonna, so I hope it comes across as one. Somebody who's very much been grounded in first opinion and well in small animal practice.
Yeah.
It's having that practical approach, which I think people sometimes commented about me with the dermatology, because I was a first opinion vet, but I also did referrals. So you have that nice mix of understanding how do you practically, in 10, 15 minutes. I wrote a magazine, a Vet Focus magazine, with a couple of other dermatologists for Royal Canin, called the 15-minute consult. How do you get that dermatology consult? How do you get through all the stuff you need to in 15 minutes? And sometimes it's take the history, but actually we've been struggling with this dog, cat, rabbit, guinea pig. Let's spend a bit longer with it. Let's charge you a bit more. Let's admit it to the back. Let's do skin scrapings or whatever. It is putting that time aside, but maybe breaking it up or maybe doing it over 2 or 3 consults, but you get to a final, hopefully good conclusion.
Definitely. And one of the things that I get fed back to me when I give webinars or lecture at a conference is that my advice is practical based.
Hmm.
So it's actionable immediately to vets that are in clinics. And that's the feedback that I've been getting about the book as well. It's made me cry. Actually, some of the
Oh,
reviews have made me cry.
oh, that's nice.
Good tears, good tears.
Yes.
But that's the fact that they can pick it up and immediately use the book in clinic and not have to translate it. Yeah,
It's just, and it's one of those. I was looking at a book, another podcast that I've done recently, and again, very similarly, very practical approach. Which when we set up Webinar Vet, the vision is to have the world's most confident vets. If you are familiar, if you have quite a lot of material, so not knowledge, but also a way of approaching cases that you see through, going through the webinars, like the webinars you do for us, then if people are confident, they're less likely to get agitated, nervous when they're in the consulting room. They're more likely to sort of radiate that confidence to the client, which gives the client confidence. They're more likely to have good client relationships. It
yes,
really starts from the basis of, actually, I am here, I am knowledgeable in my subject, and I'm here to give you good advice, rather than, well, it's kind of up to you. What do you want to do? No, we're here. I think we talked about it before, this triangle of vet,
the
client,
teamwork.
and pet.
Yeah,
And it's a collaboration, isn't it?
it's got to be teamwork.
We, of course, rely on the client to make sure medicines are given, that there's compliance, that side. But in the end, we are the person that they've gone to see to try and get that expertise to sort their cat, rabbit, dog, whatever out, aren't they?
Definitely, definitely. And I had a client in this morning. It was a referral, and it was a guinea pig, and the owner's like, "I can't thank you enough for saving my pet guinea pig." And I said, "So you're more than welcome, but arguably you did the hard work at home
Yeah.
because I can do the diagnosis, but I can't. I'm not the one at home giving the medication. So it's got to be teamwork between us. So
Yeah.
you need to take some of that credit yourself because yes, I figured out what was going on, but you were still the one that had to give the medicine."
No, exactly. It's a really good point. So, yeah, demystifying rabbits and small mammals, exotics made easy. It's by 5M Publishing. As I always say, it's available from all good bookshops. Do
It
go to your
is
local bookshop and order it, rather than from some of the online ones, because we like, at least I like to see a bookshop on the high
on
streets
the high
wherever you
street.
live.
I do as well. I do as well. And it's like 400 pages long.
Yeah.
People keep saying to me, "Oh my goodness, it's a lot bigger than I was expecting."
There's a lot of knowledge in that head of yours that you've had to get down over the last 2 years.
Yeah, yeah. One of the reviews said it was like having Madonna in your pocket. Now, arguably, it depends who you talk to whether that's a good or a bad thing.
Yeah,
But
exactly.
and when you said about the webinar vet that one of your aims was to create confident vets. I actually had a couple of delegates. I was at the British Veterinary Zoological Conference, BVZS conference in November there, and I had two delegates come up and thank me because they'd watched a couple of the webinar vet webinars and it helped them with specific cases.
Oh, it's brilliant.
So, but it was specifically webinar vets
Hmm.
ones. So, yep, you're definitely managing it.
Thank you, Madonna. Well, we've got to the stage now where we've got 3,000 hours on the site. We've just translated them into 22 different countries, because the mission was
Wow.
very much to make veterinary education accessible and affordable to vets all over the world. Because, of course,
Yeah.
we are so fortunate. The universities in the UK are very high standard. And so we are taught to a high level. But if you're in some developing countries, they don't
Yeah.
have the ability to get this. And of course, if we're able to help vets become better, then they treat the animals better. And I think that's why
The
we kind
animals
of
win.
all became vets in the first place, isn't it? To make the animals better.
Oh, definitely. Definitely. I think that, and I think it's important that we remember that because I'm 23 years qualified and I
Mm.
still love being a vet. Do I have stressful days? Yes. Do I have days I think, oh my goodness, why did I do this to myself? Yes, because I'm human. But I still got up and do it all over again because originally I got into this job to promote welfare, higher standards of welfare and care for all species. And I still enjoy doing that.
And as you say, if you're 80% of the time enjoying the job, 90% of the time, then it's the right job. I'm obviously not in practice now, but I did, like yourself, about 26 years in practice. Wanted to be a vet from when I was 8, and it's one of the best jobs in the world. There are very few jobs when you tell somebody what you do that they go, "Oh, that's so lovely."
Yeah.
When you say, if somebody's a banker and they go, "Oh, I'm a banker," nobody goes, "Oh, what a lovely job." So we are fortunate, and yet somehow I was talking to a young vet recently who was not finding it that easy with the first job, and so they've moved on to a second one. We've helped them with that. It's so important that we do support, because I have this kind of theory: if we can get vets through their first 5 years, actually the job's very easy.
Yeah,
80 to ninety
yeah,
percent of what I did, probably anybody, any vet could do. Then there's the 10% that's difficult, and that's the challenging bit. But that kind of makes it interesting, doesn't it, when you have a
it
case where you're
does.
scratching your head and going, I can't really work out why this isn't working or whatever. But the majority of the job is straightforward, and then that gives you lots of time to cuddle rabbits and guinea pigs and dogs and cats if you want to.
And being sworn at by parrots, yeah. Or probably just as well the other species can't speak.
Do you think that, and we've talked about it quite a lot in podcasts and also in webinars, we've looked at areas that perhaps vets come out of practice not being out of university, not being as well trained as they could be, albeit, we've got such fantastic training in the UK, things like dentistry, things like exotics. Do you think we've got the balance right now? Are we, I qualified in 1990, so it's a long time since I came out of university. Are we getting exotic training right, or is it something, Burgess and ourselves do a lot of work on just training on guinea pigs, rabbits, dagoos, all of these great species? Are we doing enough at university? Should we be changing things? Is it about right now? Has there been a progress? Give me a bit of an idea of what you think about undergraduate training for some of these species like rabbits and guinea pigs.
It's definitely progressed compared to when I went through vet school. I maybe got 2 hours, whereas now they get 12 and a half, 13 hours of clinical lectures.
Yeah,
However, could more be done? Definitely. Definitely. And all the vet schools are different as to how many clinical hours that they get for the exotics lectures. But as I point out to some colleagues, more of my students are going to see a budgie than a cow. And that doesn't mean that I don't think they should get taught farm animal medicine, but I think that there are opportunities potentially being missed for blend. They already do blended learning, but there could be more of a catalogue of exotics lectures that, or dentistry lectures, these kind of things where students can dip in more. Because when Anthony, when you and I went through vet school, you were there all day. You went, your lecture started
yeah.
sometimes 8:30 in the morning, and you went through several hours of lectures. You would go to your practicals, then sometimes you had more lectures afterwards. And it's not like that anymore. There's a limit to how many lectures that they can have in a day, and there's pros and cons to everything. And veterinary education they have so much to get into it, and it is difficult. It's really difficult to change any course, and if you add something in, that means you've got to pull something out. So I don't envy the university's tasks at all, trying to fit in as much as possible. So I tend to try and take the approach of, I'm teaching them to be first opinion vets. So if I teach them the skills of it's just a body system, and teach them how to take their samples and how to interpret them, then I'm starting them all off with a firm foundation to build on. But yes, would I like to see more lectures of exotics? And certainly the feedback from the students says they want more lectures in exotics. But where, unless it was a part of the blended learning approach, I'm not sure where they would be able to fit them in. So that's where the challenges start to come in.
It's really interesting. I qualified in 1990, and as far as I'm aware, I didn't submit any work on computer. Yeah, I've got one of my reports. I'm a bit of a hoarder. It's hard to throw away university notes. I put
Yeah.
a Facebook post up a couple of years ago, and everybody said, "No, keep them," much to my wife's delight. And I've got quite nice handwriting, so it looks nice and presentable and everything. Some pictures I'd taken of working on a pig farm and things. The world has changed because we've now got the internet. And so, actually, do we need to hold as much information in our heads? Trying to find the dose of an antibiotic to, give to a mastitic cow. You had to go and find textbooks and now so much stuff is on the internet, whereas so it's really easy to find it. It happens very quickly. So we probably don't need to stuff people's heads with so much. When you think of how much veterinary knowledge has accrued and accumulated over the last 35 years, there's no way that the young vets of today can take all that in. So we have to do it differently, don't we?
We do. And it's so one of the things I've recently found out is that the students talk about Madonnisms, and it'll make sense. The digression will make sense in a second, hopefully. And I have patterns of phrase that I didn't realize how often I said it until it was pointed out, and now I can hear myself saying them.
Yeah,
And one of my many Madonnisms is: owners do not expect you to be a walking encyclopedia; they expect you to care.
yeah,
And part of being a vet is building trusted resources. And that can be other vets or your veterinary nurses. It can be online websites. It can be webinars. It
mm,
can be textbooks. And it's just about building those resources. And you're quite right. We all now walk about with a computer in our pocket.
yeah,
That's essentially what our mobile phones are.
yeah,
So we don't need to carry as much information in our head. We just need to know where to go to get it. And yes, in an emergency, there's certain things that you really should have in your head. But I'll say to younger colleagues, because I'm the vet GDP mentor in the clinic as well. I'm definitely a jack of all trades. And I will say to them, you never be frightened to look up a dose in front of an owner, because I will say, I
yeah.
still look up some doses and I'll say to owners, look, I would rather check it twice than get it wrong.
Of course. Yeah, no, it's a really good point, isn't it? And it was really nice. We had a lovely testimonial a couple of years ago now of a vet who was struggling to stabilize a feline diabetic. And he said, "Do you know what? I'm struggling here. Right, I'm going home. I'm going to look at Ian Ramsey's lecture, a couple of other lectures, make some notes, reflect. I know it's a dirty word sometimes in the veterinary profession, but we all
Yeah,
do it.
we all do it.
I
Yeah.
always it tickles me that people get hot under the collar about it. And he went back into the practice, changed a few things, and sorted the cat out. And that is,
Amazing.
what CPD is about, isn't it? We
Yeah.
don't go and do 2 hours of feline kidney disease lectures just because we want to get a certificate. We do it because the next time a cat walks it, we want to be able to treat it to the best of our ability, don't we?
Oh, definitely. And make sure that we're up to date with
Yeah,
the current thinking.
yeah. Couple of extra things I wanted to talk about. I think we talked briefly about your environmental credentials, and I know you're in a practice. It's a bit limited, the building in that sense, but you're doing a lot around circular economy, around recycling. Tell us a bit about that story as well.
Well, we do our best with what we've got. So for a very long time we've been very very strict on our recycling. We have had recycle bins in the practice for, well, I've been here 20 years. And I can remember for at least 15 years having recycling bins. So we were very, very strict on that.
What happens when somebody puts the wrong rubbish in the wrong bin?
That we speak to them about it. We will actually take them aside. Sometimes you don't know who it is because it's the fairies have done it,
Yeah,
and in which case, a reminder.
there are naughty fairies in
They
Glasgow.
are, yeah, they are. Well, I should, yeah, maybe they're more pesky pixies. But so we will actually put it out in the group chat to remind everybody about the recycling, because we do take it very very seriously for multiple reasons. But for the massive veterinary surgeries produce a huge amount of waste. They do
Yeah,
produce a huge amount of waste, and the more that we can recycle, then the less impact that's going to have environmentally. So that's really important to us. If we know who has put it in the wrong bin, we will just quietly have a wee word in their ear so that that won't happen again. We've never had to go as far as giving a warning or anything like that.
yeah,
We tend to try to manage everything as informally as possible, but it's something that we are very very passionate about, and we minimize our ordering. And what I mean by that is we still order as much as we need to do, but we try to ensure that we have as few deliveries as possible,
yeah,
or into fewer deliveries as possible, so that we are minimizing CO2 emissions
Yeah, the
and
mileage
the
mentioned.
mileage and the,
Yeah.
the environmental impact from that point of view. Whereas I think before we used to think about it, it was like, oh, we need this, so we'll
Mm.
order it, and then your delivery would come, and you maybe have three things in it, and you think, well, actually, did we really need to do it that way? So just being a little bit more aware of the impact.
And the other side of that is obviously if you have lots of drugs that go out of date, one, they've never fulfilled their destiny of, treating an animal, but they're also, it's a waste of money, but also it's been a waste of carbon in producing that in all the resources. And then how do we dispose of it so it doesn't contaminate the
Yes.
environment? So all of these areas are really important. I did a circular economy certificate last year with Cambridge, and they had a stat 46% of food is wasted, at some point in the journey, either in your fridge or,
Yeah,
at the supermarket or before it makes it to the supermarket. And
that's frightening.
the more we can kind of prevent those wastages, the better, isn't it? And this is why I'm also saying to you, Madonna, here in public, so you can't get away with it. You've got to go in for our Veterinary Green Award. You've got a month till the end of April.
Okay, okay, I will apply. I will apply because there are there are things,
There you go.
and
It's
yeah,
on.
we
It's
should
on
all.
record now. It's on
Okay,
record.
yeah, I will apply for it because when the more I think about it, although I'm sure it's things that other veterinary practices do as well. That if we've got a cut paw and we want them to have a welly boot for going out, taking the dog out a walk, then we will utilize old drip bags for that
Yeah.
because then
Repurposing
we're repurposing. We are repurposing.
or repurpling, isn't it?
Yes, repurpling. Oh,
Yeah.
repurpling means my hair, Anthony.
This is, for those not listening, Madonna has a very, very nice purple shade of hair color at the moment, which looks. Can I say it, Madonna? And
Oh yeah, go for it.
can I say it looks very fetching? That's a
Oh,
very.
thank you.
That's a very sort of. That's probably a 1920s word. Never mind a 2020s word.
I thought you were going to ask me if it was natural. That's why I said to go for it.
No, it's really brilliant. I would just encourage people, if you're listening to this before the end of April 2025, it's been really interesting chatting to some practices and vets and them going, oh, we're not really doing much. And then you actually start speaking to them and they are. And I think these stories, are uplifting for us all because we all kind of realize there's a bit of an environmental crisis going on, that we should be doing something about it. Remember, there was a BVA survey, 89% of vets want to do more on sustainability, but often they don't know where to start or they don't think their efforts are particularly important. But, one thing that you do is better than doing nothing, isn't it?
Definitely. And it would not have occurred to me. I was aware of the Green Awards. I was aware of them, but it would never have occurred to me to apply because I just didn't think we were doing enough. But I will apply.
Thank you, Madonna. So finally, I think we've got enough time to talk about this. People can always switch off if they're getting bored by us.
Yeah.
I can't imagine they're getting bored of you, Madonna, but it's always possible
Oh.
with me. Yeah, interestingly, and it's obviously a bit of a theme in veterinary medicine at the moment. You have huge talents, I think I am fair to say,
Thank you.
but you kind of also got to a point in your life where you were thinking, is there something that needs to almost be checked out? People are telling me, I think it was university students you said were
My
telling you
students, yeah.
that there
Yeah.
might be a bit of ADHD going on, and maybe, I mean, we're all on the spectrum, but potentially a bit on the spectrum as well. And I think women showing autism is often quite different from men showing it as well, isn't it?
Totally. And they present totally differently with their ADHD as well.
Yeah. So was that quite an interesting journey to go down and have this diagnosis by students?
Diagnosed by students that then led on to a formal medical
Yeah.
diagnosis. Yes.
Confirmation.
Confirmation, yeah. It was. So my vet students started telling me about 3 years ago. They were like, you do realize you're ADHD? And I was like, yeah, very good. And I just kind of ignored it. But as the years went on and more of the students kept saying this to me. And then one of my friends, her daughter got diagnosed with ADHD, and when she was filling out the questionnaire, she said it was like Madonna, Madonna, Madonna. I thought, well, maybe I should pay more attention. And then some of my students started saying to me, "You do realize that you're on the spectrum?"
Hmm.
And I said, "Well, that's the point of a spectrum. Everybody's on it." And they're like, "Yeah, but some of yous are further along it than others."
Hmm.
So, I started reading more about it and realized that ADHD and autism presents completely differently in women, or it can present completely differently in women. And so, as part of a little bit of self-discovery, because there's certain parts of my personality that I've always struggled with, never quite feeling as if I fitted in. Always, like, I get hyper fixated and hyper focused, and I'm lucky enough that I found a profession that actually is of benefit, and that's what's driven my love of exotics, really, or my care of exotics, and me probably finding it easy because I look at things in a slightly different way.
It's funny, isn't it? Because ADHD, I think I've got this right, is attention deficit hyperactivity disorder. Is that
Disorder,
right?
yes. Yeah,
And yet, in women, you've just said there that actually you become hyper focused and almost can't do anything else. We often talk about women being able to multitask, and men
yeah,
can't do that. I know it's a stereotype, so
yeah,
I
yeah.
understand that, but that is quite different, then, isn't it? So instead of being not being able to pay attention, if you like, you become super focused on it.
You can do. So my official diagnosis is autistic ADHD. So, which apparently is the hardest one to diagnose. And I was like, yeah, of course it is, because it's me, and I don't know anything easy.
Hmm. So say that again. That's autistic
Autistic ADHD. So I have
ADHD, right?
both.
Yeah.
And women with ADHD tend to show hyperactivity in their head, like mentally, rather than the physical way of
Right.
showing hyperactivity, which tends to be more the male presentation.
So you feel that the kind of head is buzzing all the time. You can't
All the
relax.
time. I've had insomnia my whole life.
Right.
And I would say to
We do
doctors,
courses on it, Madonna. Look up the sleep courses. I'm
I will
told
have a
they work
look.
really well.
I will have a look. And I would just say to the doctors, I can't switch my brain off. I just cannot switch my brain off. And never once did MD think, oh, maybe she's got ADHD because it presents differently. And apparently, women with ADHD can develop like, hyper focus, but that's probably more my autistic traits.
Hmm.
And the problem with the dual diagnosis is that my work wife describes me when she first met me. She says, "You're an extroverted introvert, Madonna," and I'd never heard that term before. But it actually described it perfectly because the ADHD part of me is very extroverted, very chatty, and that's why I can get up and give lectures in front of hundreds of people, or I can get up and sing in public. And then the autistic side of me is the introvert that just wants to run away and hide, being around
Hmm.
people, but also is very organized and hyperfixates too. So the combination sometimes cancels each other out, and sometimes they're fighting. So it depends on which day, which trait is more dominant. So as I can, like the BVZS conference, I'd been doing a lot of talking to other vets and veterinary nurses. I'd been sharing opinions and lectures. And then when I got in the car to go home, I burst into tears. And I was
Hmm.
sobbing. And I said to my work wife, I don't understand what's going on. She says, you're overstimulated. And this is pre diagnosis. You're overstimulated, you're overpeopled. And once I got my diagnosis, I was like, right, okay, now she was 100% right. So it doesn't change anything for me from the point of view other than I can give myself a little bit more grace
Yeah.
to accept parts of my
Be
personality
kind
that
to
maybe,
yourself.
yeah, be a bit kinder to myself and understand myself better, because I've always been a person, if I can understand something, I can process it and cope with it and move on. But see, if I can't understand something, that's when I will struggle. And that's the same with cases. And you said about how that colleague you'd spoken to about the diabetic cat went away and did more research into it. Well, I'll do that. Some of my best case breakthroughs are at 3, 4 in the morning when I'm lying processing information and thinking about
Hmm.
things. So yeah. It's interesting because people getting these kind of diagnoses, it can really, there's a bit of a dichotomy. You get one half of the population's like, you shouldn't label everything,
Hmm.
and that labels can be harmful, and then you've got the other part of the population that wants to label everything. I think I'm kind of more in the middle. I think labels are useful if they help the individual that's being labelled. But but we still have to be, cognizant of their use, and they're not there to excuse bad behavior per
Yeah.
se, but they can be used as a way of reframing and understanding a certain behavior. I can be guilty of giving an answer before someone has finished asking the question.
Hmm.
And it's something that's bugged me for years that I do it, but it's just because my brain is running so fast,
Yes.
and I now have proof that I am an ultra fast processor of information. I'd been told that for years and I never believed it, but that's why I do it. But it's part of the ADHD, and it's part because my processing speeds are so fast in
If
tests.
you look at that at the end, and we'll probably draw it to a close, but the word disorder, disease, this is the
Yeah.
superpower. I think we are in danger also of, we all have our strengths and our weaknesses, and we shouldn't turn that into a disability.
No, and definitely for me, it's not. I've not found it a disability. There's been parts of it I have emotionally struggled with over the
Yeah.
years, and that led to a lot of internalized anguish and self doubt and that negative internal narrative. Whereas now I can stop that to a certain degree because I can understand why I do it. I'm not doing it because I'm being like I intend to be rude. I'm not interrupting because I'm not interested or I'm disrespecting. If I catch myself interrupting, I always stop and apologize and
Yeah.
let the other person finish. But I used to get so angry and so horrible to myself mentally when I did these behaviors. Whereas now, what I can say is, well, it's due to the fact that you also have ADHD, you've apologized, they know it wasn't meant disrespectfully or intentionally,
Yeah.
and then I can let it go. Whereas in the past, I
Yeah.
couldn't.
It's, as you say, being kind to yourself, isn't it?
Yeah, yeah.
Madonna, it's been lovely speaking to you about all sorts, but particularly that, because I think it's such an interesting area. Obviously, it's an area that's very topical also within the veterinary profession. So it's
Yes.
great to hear the different stories, and obviously we learn by listening, don't we? And we teach as well. So thank you for your teaching today to me as well.
Thank you. And thank you so much for having me on. I've really loved speaking to you.
Ah, thanks, Madonna, and enjoy the rest of the day. I'm looking at all these cards here. Have you got any more cases to see, or?
Oh, yeah, I'll be on till about the back of 7 tonight.
Oh, well, enjoy. Hopefully, there is lots of interesting and lovely bunnies and rabbits and dogs and cats coming in to see you. And thanks for all the great work that you're doing at all levels of the profession. It's been really good to have a chat.
Thanks, Santi. I really appreciate it. And thank you to Webinar Vet for everything.
Thank you, Madonna. And thanks everyone for listening. Do hope to see you on a webinar or a podcast very soon. Take care.